Hi friends, welcome back to my YouTube channel. So first of all, please subscribe to my YouTube channel. Then coming back to our today's topic is redistribution of pressure in integumentary, pressure redistribution, seating and positioning and support surface. So let's start the video. Pressure redistribution. Introduction. Multiple intervention strategies are needed to prevent and treat pressure ulcer. Managing loads on the skin and associated soft tissue is one of these strategies. A comprehensive care plan should include pressure redistribution strategies for individual both while in bed and when seated. Properly chosen support surface, adequate periodic pressure redistribution, protection of especially vulnerable bony prominences such as heels, and consideration of special patients' needs are essential component of the care plan. Support surface performance parameters. So there are the 9 parameters must be considered when evaluating the characteristics of support surface for the patient with a wound. Number 1 is redistribution of pressure. Number 2, moisture control. Number 3, temperature control. Friction control between the patient and the product. Infection control, flammability, life expectancy, fail safety, and product reputation. So they are the 9 parameters that must be considered, and these parameters are most important because of any kind of patient with a wound, and protect from these infections are temperature or moist control. Next one is soft tissue biomechanics. So what are their biomechanics of their skin are soft tissue. Human soft tissue consists of a variety of microstructures including skin, fat, muscles, vessels, nerves, ligaments, and tendons. Connective tissue, fibroblasts, extracellular matrix, macromolecules. Two main classes of macromolecules. Number 1 is polysaccharides and number 2 is fibrous protein. So this is the very important point of any kind of biomechanics, especially of soft tissue. And now what are the function of these main two classes? Number 1 is providing lubrication and shock absorbing qualities, because the skin is the main barrier to absorb shock, any kind of shock. Number 2 is resist comprehensive force on the matrix, and the third point is provide tensile strength and resilience. So these 3 points of are the function of these macromolecules. Tissue mechanical properties. Number 1, soft tissue is an anisotropic, incompressible biosolid biofluid mixture. Because soft tissue is largely incompressible and it tends to move slowly from areas of greater pressure to the areas of lesser pressure. Number 3 is this slow movement of ground substance and initial fluid is responsible for the time-dependent vasoelasticity behavior of the soft tissue, manifested as 4 phenomena. Number 1 is stress relaxation. Number 2 is creep, hysteresis, and pseudoelasticity, preconditioning. So these 4 are the points of this. As you guys see the phenomena, stress relaxation phenomena and the creep phenomena. Pause the video and clear your minds of views. Now what is hysteresis and pseudoelasticity? During the cyclic loading such as that produced by the dynamic and alternating pressure matrices, the stress-strain relationship demonstrated during the loading phase is different from that of the recovery or unloaded or portion of the cycle. What is pseudoelasticity? Increase in the repetitive and predictability of the tissue's stress-strain relationship following a defined period of repetitive cycling loading. Now, tissue loading and pressure ulcer formation. Body weight resting on the body prominences such as scapula, sacrum, greater trochanter, ischial tuberosities, and heels can cause a significant concentration of pressure at the skin surface and in the underlying soft tissue. These pressure peaks and the pressure gradient surrounding these peaks can put into the soft tissue at risk for breakdown. Damaging effect of pressure are related to both its magnitude and duration. Now, what are the risk factors? At cellular level, there are the 3 mechanics most commonly cited to describe how the external forces result in tissue damage are. Number 1 is ischemia, resulting from tissue deformation. Number 2, reperfusion, injury following pressure relief. Number 3, mechanical damage to cells caused by excessive deformation. In addition, clinical implication of aging. All of the well-known intrinsic pressure ulcer risk factors, pressure, sheep, friction, temperature, and moisture, tend to influence the tissue ability to withstand loading. Limitation of interface pressure as a predictor of tissue damage. Tissue interference pressure is the force per unit area that acts perpendicularly between the patient's body and the sport surface. Moving forward toward the sport surface characteristics. So they are the 4 main characteristics. Number 1 is pressure redistribution, shear and friction reduction. temperature control, and moisture control. So we have different kinds of products that we can use in wound care and especially in positioning sports surface performance. So vasoelastic gel seat cushion which are used, and fluid filled products are used, risk mattresses are used. So this is the very important for cushioning and providing support. Now, what are the features of sport surface? Number one is air fluidized, low air loss, alternating pressure, and lateral rotation. So these important points are the features of sport surfaces. As you guys seen in the diagram of these important features are and its functions. So what are their functions? Pause the video and clear your mindset. Now, what are the patient's management? What are the patient specific load management need? Proper selection of mattresses and wheelchair cushion, which is the most important. Prevention strategies, product effectiveness, treatment of effectiveness, proper positioning, and heel protections. As you can see in the diagram, there are the three different positioning on the wheelchair, which providing and functioning from patient. Now, number one is positioning. The following 8 positions are commonly used to reposition patients on a horizontal surface. Number one, a prone position with a rotation of 30 degree to right or left. A supine position with a 30 degree of rotation to right or left. The third point is a supine position with a slight right or left sacral relief. Number 4 is a supine position with the head of the bed elevated 30 degree or less the feet blocked. Number 5, a supine position with the head of the bed elevated 30 degree or less the knees flexed with as you can see in the diagram with the patient from different positioning from spine to prone and different angles. Now, what are the basic needs that patient need to care about before purchasing any sport surfaces? Number 1 is ease of use. Number 2, operational cost of equipment. Number 3, service contracts and backup services. Number 4, alarm systems and daily maintenance. And the last one is operating mechanism and the space requirements. So these are the important patient factors before purchasing any sports surfaces. So today we talk about in detail with a complete lecture of pressure redistribution, in which we will talk about its positioning, sports surfaces and its management and treatment. I hope guys you like the video, then please share with your medical friend. Thanks for watching.